Hello and welcome back to the Academy of Anaesthesia. Another common exam question that gets asked is the classification of neuromuscular blocking drugs. It's a question that comes up in both the primary and the final FRCA. The most common way of classifying is to use the depolarising and non-depolarising denominations. The problem with this method is that it leaves out a few clinically relevant drugs. I'm going to show you a quick and logical way of classifying neuromuscular blocking drugs which relies on physiology that you already know. To start off with, let's begin by drawing a neuromuscular junction. Here is a presynaptic nerve terminal, and here is a postsynaptic membrane of the muscle cell. This is a vesicle containing millions of acetylcholine molecules, and here is a presynaptic voltage-gated calcium channel. And here is where the choline enters the cell to be synthesized into acetylcholine. And finally, on the postsynaptic membrane, there are nicotinic acetylcholine receptors. As a quick recap of the physiology, acetylcholine is synthesized from acetyl-CoA and choline. When an electrical signal travels down the axon to reach the nerve terminal, it causes calcium channels to open, and these are voltage gated. This leads to calcium entering the nerve terminal. This calcium then triggers the release of the vesicles containing acetylcholine via a process called exocytosis. Acetylcholine enters the synapse and it attaches onto the nicotinic acetylcholine receptor and causes it to open. This occurs several times over the whole postsynaptic membrane, which will eventually result in muscle contraction. Now, drugs that affect any part of this process are technically neuromuscular blocking drugs. So let's take it step by step in a chronological order. The production and packaging of acetylcholine into vesicles is disrupted by hemicholinum. It's a common drug that's used in the research of neuromuscular junctions. Number 2, we have the calcium channel. Here, both magnesium and gentamicin have antagonistic effects. By blocking the calcium channel, the vesicles will not be triggered to release the acetylcholine, and therefore no further transmission takes place. This is also a common SBA question, which usually asks which drugs prolong the effect of neuromuscular blockade, with gentamicin or magnesium being the correct answers. The third target of drugs is the vesicle itself. Here, the common agent botulinum toxin, which cleaves a protein called SNAP25 and prevents vesicles from fusing with the presynaptic membrane, blocks the release of acetylcholine into the synapse. Tetanus toxin also causes the disinhibition of motor neurons, leading to an excessive firing and depletes these stores as well. And finally, number 4, we've got the nicotinic acetylcholine receptor. I won't go into detail about the receptor itself, as I'll be making a separate video on the topic, but the receptor is where both the non-depolarising and depolarising muscle relaxants work. Before I classify the drugs that act on the nicotinic acetylcholine receptor, can you guess which drug group I've left out that also affects this process? I'll give you a few seconds. So the drug group I deliberately missed out are local anaesthetic drugs. It does block transmission of the electrical signal coming to the neuromuscular junction, and so technically it is a neuromuscular blocking drug, but I can guarantee you it won't be on the examiner's mark sheet, so it's not worth mentioning unless you've already finished the station and answered all the questions. Last but not least, let's quickly go through the classification of drugs that act at the nicotinic acetylcholine receptor. You have depolarizing and non-depolarizing agents. Depolarizing is easy as the only clinically relevant one is succinylcholine. Non-depolarizing agents include aminosteroidals and benzyl isoquinolineims. This classification is based on the chemical structure of the drug. Within the aminosteroidal group, in the order of increasing duration of action, you have vecuronium, rocuronium, and pancuronium. In the benzyl isoquinolineims, there are 3, tubocurarine, which is rarely used nowadays, mivacurium, and atracurium, which also includes cisatracurium. So there you have it, a way more logical classification method for neuromuscular blocking drugs, and it is extremely easy for an examiner to follow and give you full marks. Although this is more geared towards a pharmacology question, it helps also to revise the physiology. and so the same diagram can be used in a physiology VIVA. I hope you found this useful, and if you have any future video suggestions, then please do let me know. Likewise, any feedback on the production value of the video, please leave them in the comment section below so that I can improve and make better videos. Thank you for listening, and see you in the next one.